So, are you suffering from red, itchy, swollen eyes, or do you constantly feel the need to keep rubbing your eyes? Then you are probably suffering from eye allergies. In today's video, we will be discussing what are the various home remedies that you can do if you are suffering from the symptoms of eye allergy. Hello everyone, I am Dr. PayalPandit. I am a board certified ophthalmologist and a cataract and refractive surgeon, and on this channel we try to discuss all eye related diseases and try to simplify them. Now, eye allergies are generally caused as a result of a hypersensitivity reaction. Now, this reaction can be due to various factors. Several of them include air pollution, atopy, or it can be as a result of dust, pollen from the flowers, or due to the fur from pet animals. Even genetics play a role in causing the hypersensitivity reaction, making you susceptible to certain particular allergens. What generally happens is that when that allergen comes in contact with the body tissue, it results in a hypersensitivity reaction. Now, because of the seasonal nature of some of these allergens, patients do notice that when they visit a certain dusty, dry, or hot area, or when there is a change in the season, there is an increase in the symptoms of the allergies. While allergic eye diseases can occur on their own, they are frequently associated with a runny nose or allergic rhinitis, or it can be associated with atopic dermatitis, which is itching all over the body, or even asthma. As I mentioned earlier, allergic eye disease is a type of hypersensitivity reaction. What happens is that when the allergen comes in contact with the body, there is a breakdown of mast cells. Now, what are these mast cells? So, mast cells are a part of the immune system and they are protective in nature. Whenever an allergic substance or even a foreign body comes in contact with the body, what they do is that they break down and release histamine. And histamine is the product that is responsible for the various reactions that we see in the form of itching, watering, redness, puffiness, and the other symptoms. Now, this is similar to a car alarm which starts ringing when there is when there is someone trying to open the car door without a key. So, in a similar way, the mast cells basically act as a car alarm for the body and make it aware that a foreign substance is trying to gain entry into the body. So people might experience watering, itching, redness. There might be a generalized irritation in the eye. There might be swelling around the eyes. And in some patients, they even experience ropey type of discharge, which seems to keep coming out and sticking the eyelashes. So what can you do to protect your eyes? Well, the very first thing that you can do is ask yourself a simple question. When are these allergies maximum? Like, is it in the morning, or when you are out on a bike, or when you're cleaning or dusting your house, when you're playing with your pets, when you eat certain foods? So this simple question will make you aware of what it is that you're actually allergic to. By finding out what you're allergic to, it will be easier for you to avoid that particular substance, because all the treatment options that are available is mainly aimed at treating the symptoms of the allergy, and it does not take into account what is causing the allergy. So suppose you have stopped your medications, these symptoms can come back, especially if you are exposed again to whatever it is that you're allergic to. Now, once you have an answer to the question of what exactly it is that you are allergic to, the next thing you can do is maintain eye hygiene. Now, this can be done in the form of sterile wet wipes, which can be used to clean your eyelashes and lid margin. And what this will do is that even if an allergic substance has gone and is very close to your eyes, it will help to clean it off. And as a result, your body will not have such an intense reaction to that allergen. So an important thing that is to be done is gentle cleansing of the eyes, especially twice a day during the allergy season, which can be done. It can be in the form of a foam cleanser, or you can use sterile wet wipes, whatever you're comfortable with. Now, another thing that is important is to consider is, are you guys using makeup? So if you're using eye makeup in the form of mascara, liner, or even kajal, you have to first of all check for the expiry of that product. Now, if it is an expired product, there are chances that whatever ingredients are there might be causing the allergic reaction. Another thing that you can consider is, where are you storing your products? Is it in a place where the products are likely to collect dust? If so, not only are you exposing yourself to allergens, but you are also increasing the risk of eye infections such as conjunctivitis. The third thing that you should look at when you're using your eye makeup products is that whether you are sleeping with those products on. Because if you're sleeping with your eye makeup on, it increases the duration of exposure of that eye makeup, especially throughout the night, which increases the risk of allergies inside the eye. A bonus tip for you guys. Now, a lot of these makeup products are made with certain ingredients such as alcohol, fragrances, and essential oils. A lot of people are allergic to these fragrances and essential oils. So it is very important that you read the ingredient list of the eye makeup that you are using and try to see that whether you are experiencing these symptoms, especially after using these products. Found this video to have some value for you, or if you're enjoying the video so far, please do click on the like button and do subscribe to this channel. This tells me that you guys enjoy such content, and I will try to make more such videos in future. Now, the next thing that you can do is that if you're suffering from dry, red eyes which are inflamed and which are watering, you can consider using lubricants from the pharmacy. Now, these lubricants have a dual action. One, they help to soothe that inflamed red eye by forming a protective barrier between the eye and the eyelid. Second, they help to remove the allergen if it is present within the eye. It helps to wash out that particular allergen from the eye, and therefore you can actually consider using lubricants. But while buying the lubricant, it is essential to check whether they are preservative free, because certain preservatives which are present in the lubricants to increase the shelf life of the lubricants, those can in fact cause itching and allergies too. So make sure to check the label for whatever product you are buying. An extremely beneficial but often overlooked remedy is to use cold compresses. Now, what exactly are cold compresses? It is basically anything which is cold, which is being placed over the eye. Now, this can be in the form of gel packs which you are keeping in your fridge, and you can just place them over your eyes for like 10 to 15 minutes. And this helps to reduce the swelling around the eyes, the puffiness around the eyes, the inflammation, and even causes a generalized soothing effect to those inflamed eyes. If you don't have gel packs, you can even use a simple water bottle which you can take out of the fridge and just place it over your eyes for a few minutes. It will cause a lot of relief. Now, a very important thing that I keep stressing about and keep telling my patients every single time is, do not rub your eyes. Now, the reason behind this is that when you rub your eyes vigorously, it causes a breakdown of the mast cells. Remember those mast cells that we spoke about earlier which release histamine? Yes, the very same mast cells. So when you rub your eyes vigorously, those mast cells break down, histamine gets released, and because of that histamine, yes, you're right, it causes increased itching. So whenever you rub your eyes, you are actually causing the itchiness to increase rather than reducing it. So avoid eye rubbing at all cost. If your eye allergies do not reduce even after using all of these home remedies, then it is probably good to visit your eye care specialist or ophthalmologist at the earliest, because they have specialized medicated drops which they can provide you with, as well as other ointments, oral medicines which can be prescribed. And it is best not to self-medicate in this condition, as these anti-allergic drops have to be used only for a particular duration, and using them beyond that particular duration can have side effects which your eye care specialist will be able to guide you better with. And if you guys want to know more about infections that can occur with eye rubbing, do check out my video on sty, which I'm linking in the description as well as on the screen in front of me. And so I'm gonna say bye bye for now, and stay healthy, keep those eyes safe. See you all again very soon in the next video. Bye bye.